Welcome to the show, everybody. Michael with CoronaVirusDiaries, and today I'm fortunate enough to be able to reconnect with Gabrielle Arrowsmith, a health unit coordinator at a local Twin Cities hospital. Gabrielle, how are you?
I'm good, doing well, hanging in there.
Yeah, so since the last time we spoke, it's been quite a while actually. There's been a lot of stuff that's taken place here in the Twin Cities, Minneapolis. Um, there's the George Floyd murder that had taken place, and the protests and riots subsequently thereafter. It's calmed down in the sense that the city's not burning anymore, but there's still some significant political actions that are taking place, and a lot of stuff that we just probably won't even have time to get into for our show. I'd like to touch base, maybe get a little bit of your thoughts on it. We were talking a bit about this notion of a divide, like physically between just block to block in a city, how fast things can change. But before we get there, what's new with you in terms of the hospital, the furlough you had shared before? There was a reduction, and there's just a lot of stuff. I mean, COVID's still out there; it's still doing its thing, and there are reports that even the Memorial Day loosening of restrictions in our neighbor state, Wisconsin, Minnesota has seen a surge. What's your take on that, and kind of where you see things going?
Yeah, so I am still on furlough. I have at least 3 more weeks on furlough, just kind of waiting for a baby to arrive, and then I'll be back at the hospital. I've gotten some information from people that I know who work there, kind of saying because they happen to be right in the area where a lot of the protests were occurring, so they were on lockdown a number of times at the
Protests or
beginning.
riots?
Riots. It was riots at that time. Yeah.
Yeah.
Yes.
I'm splitting hairs here just because I was called out on it myself. Verbiage is like so paramount at this point.
Sure.
Anyway.
Sure. Yeah. Protests wouldn't have caused the problem. It's the riot aspect of certain groups within those protests, that caused the hospital to have to go into lockdown at several different points during kind of the aftermath of George Floyd.
Sure.
So that was, I know, kind of disrupted work and whatnot, and was not great for employees there. It was hard to leave when it was time to leave from your shift and that type of thing, to get home to families. So tricky, difficult stuff going on at the hospital right now.
Sure.
I also know at the hospital they are continuing to send people home. So even those who have not been furloughed, who are working, like if it's slow at all at any point in the day, they're sending people home. So even though we're already low staffed, they're just trying to continue to make grounds as far as budgets wherever they can.
Wow.
Yeah.
Wow. Yeah, I know some folks that do security operations in the city, private security, and there was a need at these hospitals because the law enforcement was out doing whatever they were doing, the military was doing what they're doing. And then you just think about the critical infrastructure in the city, and healthcare being one of them. There's like a children's hospital that was getting smashed to pieces at one point. It's just, it was just sad to think about, the workers that are in that environment, because they're trying to help everybody. And I can only imagine what that was like. So with
fears are real. It wouldn't be the first time. Like, I know at one point there was a stray bullet that had, not during this current situation, but there was a stray bullet that had hit in the skyway. Another time, I think someone within the hospital was injured over in the mother baby area. So the concerns were real when folks go into lockdown there.
Yeah.
Yeah.
Yeah. And especially because, some of these hospitals, they were in a hot zone. They were like, you drive by and you see burned out buildings around the hospital, boarded up. But, so it's a perfect segue in terms of just kind of environmental, the environment and how rapidly things can change. And I was sharing with you that, the last week and a half has been pretty chaotic for me, in the sense that a lot of the stuff that took place was about 5 blocks away from where I'm at, 5 or 6 blocks. But there was a highway that separated it. And I was sharing that, there's this great divide. There's many divides right now, but there is a big divide in equality in society. And how me just being even 5 blocks removed from Midway, this area that really saw heavy impact, I might as well have been on Mars. you know, like we could hear the noises, we could hear flashbangs and the rubber bullet gunshots and people yelling, and you could hear everything happening, and you could smell like the smoke was coming into my place. But there's people out walking their dogs, you know, and there's kids out in their front lawn just looking at their parents like, what's going on that way, you know? So like this notion of a great divide and the separation of just some distance. And you'd shared a little bit about your time in LA, and curious if you wouldn't mind sharing a bit of that now.
Sure. Yeah. So similarly, I had done a service learning trip when I was in college, and our focus was working with men in homeless shelters designed for men, right in the area that you would call Skid Row in LA. And it was just incredible to walk, because we walked everywhere during our time there, and you would walk just a few blocks, and it was, you know, high rises in this business area and residential housing that was breathtaking, you know, just incredible. And then 5 blocks, it's like, it's people who are suffering from poverty and mental illness and addiction and things like that. And yeah, it was very eye-opening to walk that distance and watch as you take steps, you know, watch the surroundings change.
How long were you doing that type of work for?
It was just a J term over like the winter break from college.
Oh, okay. Oh, right.
Yeah.
Right on. Yeah, that'd be pretty solid. A great experience to get involved in that.
Mm-hmm.
You know, I've been noticing a lot of
the most rewarding times of my life, like just being able to help people in need, you know, was really rewarding.
Sure. Yeah, one of the things that, like, as I was doing some documentation of this series of events, you know, right after I had gotten word, it was, you know, Tuesday morning, there was, I believe, a City Pages article, and I'm sitting here reading it, and I'm like, this, like, what? You know, like, I'm reading about what took place and what happened, and I start seeing stuff on social media. I'm like, yo, this is crazy. Like, this dude just got executed basically on a video.
Yeah.
And so there was that protest, a big peaceful protest at the Cup Foods 38th in Chicago. And I'm like, yo, I felt obligated, right, to go there. So I go over there, big peaceful protest, big. And at the time, I'm like, social distancing still, like I'm trying to, like, I'm on the fringe of this, you know, thousands of people that had the whole area locked down, face mask, and like for the most part everybody had the face mask on, but there's thousands of, I mean, after coming off of the tail end of like a couple months of lockdown, it was just this weird, surreal, it was just weird. It was super weird.
Yeah.
And then as the days progressed, there's, you know, these small factions broke off, became violent. Then those small factions got big, and then the rioting really took shape in certain areas, which, you know, ironically, I don't know if that's the right term, lack of better terms, the communities that it impacted were the minority communities for the most part.
Right. Mm-hmm.
Which was disturbing for me, seeing people even in my own network. And I know everybody's figuring this out as they go. I'm figuring it out myself, trying to just make sense out of, like, I get the big picture, but there's a big debate over people equal or over property, right? And this notion
Mm-hmm.
of like it's necessary. But then you look at the people that were impacted. The next day I went out, or 2 days later, and there's like food lines popping up because grocery stores are burned, restaurants are burned, like the community's shut down. You can't
Mm-hmm.
get gas, public transportation's shut down because all the bus lines are destroyed. And you, like, the lines that I saw, predominantly people of color, minority community, and like kids and babies. And it's like, we need formula, we need diapers, we need, you know, basic food, like just things where you're like, good grief, like laundry detergent. And I don't know, it's a weird time we live in, huh? With everybody wants to put things in these nice little compartments that represent this big, huge picture that's so complicated with all the different
Mm-hmm.
divides. Would be curious to hear it. Oh, but where I was going with that, I'm still processing all this. Last week I was trying to spend time, like, how am I going to put something together? The last thing I want to do is put together something without giving it the necessary thought and attention that it deserves.
Right.
And at the same time, the community is still trying to figure stuff out. I mean, they're literally talking about disbanding the entire Minneapolis police department at this time.
Police force, yeah.
But what I was getting at was the community, the notion of communities coming together, showing support, coming together to rebuild. And I guess more than that, I think right now I'm just processing it out loud.
Right.
It's been a pretty wild week and a half. I was going through footage.
Yeah.
I'm just kind of like,
Well, I like the terminology you're using as calling it like the Great Divide, because that's what this like political culture has felt like for a long time. It's been very polarized, and then we mix coronavirus into the thing, and we see that kind of take its side according to different political parties for the most part, you know, and that the divide grows. And then now we see this George Floyd catalyst for tense race relations and with the police and the divide. What we really need, what you just said, is we need communities to come together. We need people to start looking at their commonalities and just asking another person, like, what can I do to help? How can I help resolve this situation? But it just seems like there are so many people who are trying to make that divide grow, you know? Yeah.
When
To
you were out,
instigate.
yeah, when you were out in LA, were you working with, were there multiple community organizers that were kind of banding together to do different initiatives, or were you more focused on like one specific type of thing?
We did several different things. We stayed in the homeless shelter, so our main focus was connecting with the men in that homeless shelter, preparing their meals for them, doing little projects within that shelter. But then each day we would go out into different types of communities. So like Homeboy Industries was really cool, where it takes people who used to have criminal background, gangs specifically, and it would give them employment opportunities through Homeboy, which is baking and like being chefs. They would train these folks to be like chefs, and they had restaurants, and it was really cool. And then we visited like battered women's shelters. So we were looking at a lot of different kind of groups who are struggling within that community there.
Yeah.
But yeah, there wasn't any kind of collective effort to bring all of those organizations together. It was more like our group was doing our various reaching out to different parts of the community that was at risk.
Yeah, very cool. Something that I've been thinking about a lot is the notion of actually disbanding a police department, right? And a community. I have no idea if it's the right answer. A lot of people will suggest it is, based on the inequalities that specifically in Minneapolis are showing to be evident in the history, which, you know, there's going to be some interesting stuff coming out in the near future where, you know, they're going into the last 10 years. They're doing an external investigation, is my understanding, of the Minneapolis Police Department's engagements in the last decade. And it'll be very, very interesting to see stuff coming to light, how much there may have been or is this type of a culture, of an inequality culture. But the idea of a community, excuse me, coming together where they're taking responsibility of, you know, their security for that certain area, and they're saying, no, we're going to get the people to, you know, protect our community that live here, that serve here. But also like the support networks that are in place where, you know, I saw some really great initiatives. So one of my friends organized something, a 3-day event over in North. There was one here over by Midway where, you know, the amount of support that came in was nothing short of breathtaking. It was great. I mean, they were filling up Connex containers and semi-trailers with essential needs, you know, for the community. I just hope it's not a flash in the pan where, you know, in 2 weeks from now, the buildings are still going to be burned down, right?
Yeah,
The grocery stores are still destroyed. The gas stations, they literally pulled gas pumps out because they didn't want people blowing up a gas station. But this could be the turning point. You know, 2020 could be the turning point where communities really start looking, you know, and I don't know where what is it like where you're at? Because where I'm at, a lot of the areas, you don't necessarily know your neighbors so much. You might know them from passing and be like, hey, you know, like that small talk. Do you really feel like you know your neighbors to the point of like, no?
No, I don't know. I live in a townhouse community, and it's a lot more elderly folks, and, you know, I kind of say hi in passing and whatnot, but no, I don't know my neighbors terribly well. And I guess I would say in my location, I don't have a sense of like tension or turmoil in folks. I think people here are just older, retired, content, you know.
just kind of going.
Maybe sort of afraid of coronavirus, but
Yeah.
not as involved in the current the race relations with the police.
So back to the coronavirus, and then I know you've got another engagement after this, so I'll be trying to be cognizant of your time. So within your community, we're going on, what is it, March? We're going on close to 3 months. I mean, it's getting up to near 3 months of when COVID really kind of started making impacts within Minnesota. What have you noticed within your own community in terms of just interactions and kind of how people are out and about, or how, like, have you noticed kind of a shift towards more relaxation?
Yes,
Yeah.
I have, and I think it's due because the goal was never to eliminate coronavirus. That's not something that we have the wherewithal to do right now. The goal was always to flatten the curve, and I do feel like that's been accomplished. I definitely don't think an exit plan of like opening everything to its full capacity at this time is smart. But yeah, I do see people who are just like, there are certain costs to not being around family and friends and people. You know, we're relational people, and we need relationship, and we need to see people in person. And I mean, a hug, people haven't been able to hug their loved ones for 3 months. Like, it's crazy.
It's a big
Yeah.
deal.
Yeah. So a lot of people are starting to relax. And I think it's due. I don't think it's an issue
With your friends
if
that
done
are,
if done smart, you know.
sure. With your friends and associates, colleagues that are in the hospital spaces that are dealing with COVID patients, have they shared much with you about what they've been seeing? Do they feel like they're prepared enough for a potential surge, either from loosening of restrictions or from the protests and riots of these massive gatherings?
Right.
Are they confident with, the potential of 2-3 weeks from now seeing massive influx of patients?
I think they are, because I think even if even if there is sort of a spike, I don't think it's going to be that much more than the current rise in the graph, if you will. So I think they are prepared. I think we have the supplies. I think we've been, kind of sectioning off the hospital in certain ways to treat people with respiratory concerns versus those without, and taking those measures and training people appropriately. So I hope, my hope is that they do. At the same time, I do know that we're low staffed everywhere. So the good thing is the folks on furlough, they have 2 days notice and then they have to return to work. So if we start to see more than anticipated increase, they can always pull staff back. It's just going to be the financial repercussions of that choice then.
Sure. And that brings up a thought. Are you being told, or are you in a position where you could be pulled back into a position that you weren't previously working, where you'd be working directly with COVID? Are you in a position like that?
I imagine it would be possible. I think that is done on a volunteer basis. So I had the opportunity before I was put on furlough to apply for redeployment within the hospital, which I did apply for, just to say if I am low needs in my area, I'm willing to go and do something else for which I'm qualified in order to help out and to stay employed.
Nice.
So I imagine that same thing would be utilized if we saw, levels of corona coming in that we couldn't handle.
Sure. And was there any sort of like a civilian contractor type of talk where they would be bringing in people that would basically be just civilian support, like people that could basically just carry water? Was there any discussion of that, or contingency plans?
No, I think because we had the employees who were not at that time being utilized in every area, we actually suspended our use of volunteers, because we do have volunteers force at the hospital, but we suspended the use of those volunteers for their own safety, for other patients' safety. So I think the hospital would prefer to kind of use their own employees who are in the loop and, have had their flu shot and things like that. Yeah.
Wow. Well, it's been really great to catch up. I mean, it's been quite a while. I know you've had a lot going on, and I can't even, this week is going to be really trying to put together, I guess, just trying to make sense out of the last 2 weeks, and, produce something that is relevant, timely, and thoughtful. But was there anything that you were hoping to touch base on that we haven't?
No, I was just going to say on that note that I've seen some of the videos that you've put out, and like encouraging and even challenging people to come together and to help, and to find out, instead of perpetuating this divide, that it's like, come here, come to this community, come like donate or come and help and see what you can do, versus just like people posting about it and kind of fueling each other's, fueling this negativity around. I mean, obviously it's a difficult thing to deal with right now and tensions are high, but to bring people together and to help one another is really what we need. And I appreciate that you've been challenging, people to do just that.
Yeah, I've struggled with I never used to be too big on social media. I would use it more for managing like business platforms and just keeping in contact with people globally, friends throughout the world. When all this kicked off, I found myself in this position where I was kind of like, I need to report on what's happening in my own community. Totally new experience for me. I learned a lot through the process. There was this like dealing with emotions of watching your community burn at the same time of trying to be unbiased about what is happening. Probably one of the more difficult things I've ever done in my life. And it happened like in an instant. And, there's people that are respecting my network that are, promoting the notion of, riots are necessary. There was a lot of stuff. There's been peaceful protests that have been happening for ages, didn't get the attention. So they're promoting this idea of it's necessary.
Right.
But then seeing the community that's impacted, and then it's like, okay, well, does that mean shift it to communities that are a specific demographic? And it just posed a lot of questions for me. And I just hope, the compartmentalization of like trying to make something so simple, I think is a byproduct of social media, how easy it is to just share a headline or just to share these thoughts. And one thing that I found is that I got a lot of really, really positive feedback in terms of how I approached it and how I was doing what I was doing. Got some negative stuff, which I took to heart in the sense that I wanted to learn from it, because there was some good stuff there. But yeah, challenging narratives is something that I like to challenge my own narratives. And I just hope that, through all of this, people are able to see that it's not so cut and dry, left and right, red or blue, black or white, that there is definitely this middle ground, but that middle ground has like this divide just smashing right through it. So I appreciate your feedback, Gabrielle, and I appreciate your time, especially. Thanks for jumping back on. Look forward to connecting with you again in the future.
Same, Micah. Thanks for having me.
And for all the viewers and listeners, thanks for joining us. We'll be interested to hear your thoughts in the comment section below. Until next time, keep your eyes and ears open, and we'll be coming back at you.